Good afternoon, everyone. My name is Julio Barea, and welcome to another Moment of Marketing Moments webinar series here with Care Time and 52 Weeks Marketing. I'm Julio Barea, VP of Sales for Ally Care Time. We're a software company that helps agencies make more money by keeping you more efficient, helping you file and get your claims paid faster, and helping you encourage and retaining your caregivers. I'm joined today by a longtime friend and partner, Debbie Miller with 52 Weeks Marketing and Senior Helpers. How you doing, Debbie?
Hey, doing fantastic.
Can
I
you
think this
believe
is
this
our
is?
number 12 session.
I was just thinking that it's amazing. I can't believe it's 12. We started this in January of last year, February of last year. And if there's folks on this call that are still coming to see us after number 12, and I bet there's a matter of fact, I would like, if you've been on every one of Debbie's webinars and you're on this call today, please type in the chat and let us know you're here. Introduce yourself by name. We really got into this, right? When we got into this, Debbie, we had no idea what was going to happen.
Right.
It's just been
Yeah.
fantastic, really been fantastic.
And pretty much every session, we have more than 100 people that register. So I don't know what the
Every
number
single
was today,
time.
but
Every single people there taking time off their 30-minute lunch, which in the agency space is, you're lucky if you get that. You're blessed, right? But you're taking the time to spend with us. So we really appreciate it. Today we're talking about something that I think is near and dear to my heart, is talking about standing out in the crowd, basically creating your value proposition. And Debbie's going to talk about articulating what makes your home care services unique and why clients should choose you over competitors. And I think we can agree that it is something that every single day it's more and more important. I mean, gosh, how many agencies are in the Nashville area alone, Debbie, right? There must be dozens, if not more than that, and more every day.
every day. In fact, one of the topics that I'm going to bring up is just in my area alone, we've got 30 new agencies in the last 6 months.
Wow.
Just in the last 6 months.
30 agencies in the last
plenty.
6 months.
Mm-hmm.
That's amazing. And I know there's a need out there, and it's good that the people are being serviced. But the bottom line is, if I'm a business owner and you're a business owner, how do we stand out in that crowd, right? And I really like the fact that you've created a formula to really help create messaging that will elevate that marketing. And I think on the next slide, we talk about what that competitive landscape looks like a little bit, right? There's over 30,000 agencies out there. And you and I chatted before we got started, to the folks in the group, this value proposition concept is not just the agency space. Every business owner in every industry, every professional who's trying to create a personal brand, everything you do in life that you're trying to get out there and get heard by people, whether you're helping people, making money, building a business, doing charity work, it doesn't matter what you do. You have to be heard in order to get your message out. And if there's a whole bunch of people making the same message, you're not going to get heard. And so for us, that discussion in this software company, we have to talk about it every day internally. What do we need to do to make sure we have expressed our value prop? And hell, are we even clear on what it is? Which we are. I will say that we have a very defined value proposition. And so
A lot of people aren't. We're gonna review that today.
A lot of people aren't. That's right. So, Debbie, why don't we just jump right into it and get started? I know that you have a lot to talk about, so let's go.
Yes. All right. I'm going to set my timer here so I keep myself on track. And good news is senior care is booming, right? As Julio said. The bad news is everybody and their brother seem to be jumping in on this opportunity. So we've got to be as creative as we can and as distinctive as we can. So my marketer actually this month called me. She went to a networking meeting. So I told you we've got just tons and tons of new people in the Nashville area that are popping up everywhere. And she said just from the last month to this month at a networking event, there were 30, they doubled the membership. They literally doubled. So they went from 30 to 60, which was, tended to be a smaller networking event, but it went from 30 to 60. And most of the people were home care providers. So, which is, I'm not a big fan of networking events because of that very reason. But sometimes it can play a really important purpose for us to be there. But anyway, all that to say, look, when we think about the numbers of agencies that are popping up everywhere, we're looking at over 30,000 agencies across the country now. And many of them sound the same, right? They look the same, they sound the same. So it's really important for us to differentiate ourselves from the pack so we stand out. I think this picture is awesome. This is kind of what today's all about, is being that red egg so that we're the ones that get the referral. But it's easier said than done. And that's where we're going to really focus on today. Okay. So when I've mentioned before that in the home care industry, there are very few owners who have sales and marketing experience, right? They get into the business typically because of an altruistic reason. They want to make a difference in people's lives, or they've jumped on the opportunity bandwagon and they want to make some money here because there's a big opportunity. But the reality is the sales and marketing piece of the business are what most owners like the least or spend the least amount of time on. And so I was fortunate enough to have extensive marketing background when I started my home care business, and I'm so thankful for that. So when I do talks like this, I like to set the stage with some foundational sales and marketing basics so that we can level the playing field here. And so I'm going to review these the 6 keys to selling anything to anyone. And I'm going to thread these throughout the presentation, but I think it's important that we just have that basic foundational knowledge. So the first thing is we've got to understand our audience, right? And so segmenting them, understand, and we're going to dig into 3 segments here today. Understanding what their pain points are so that we can tailor our message to support them and so that our message is going to resonate with them and they'll want to refer to us, okay? The second key thing is building rapport and establishing trust. So having an engaged conversation, asking them questions, validating their experiences, communicating authentically, being yourself, right? Speaking naturally. Julio and I were talking about that earlier today. You know, why did we get into this business? Communicate it and then really focus on what you can do to help resolve some of those pain points. And a lot of times we can do that through education. I'm going to highlight the value, how education can be a real unique value proposition. The third thing is communicating your values, which is what today's all about, and your benefits. So feature to benefit, right? Based on your target, the person that you're calling on, emphasize how your solution resolves their specific problems. Storytelling, using stories, using examples can really help communicate those benefits as well. Fourth thing is overcoming objections and leveraging your persuasion skills. So you want to understand what those common concerns are going to be and have prepared responses for them. What I like to do is address some of these concerns right out of the gate and dispel them, sort of like deal with them, and now they've got ears to hear because you've removed that obstacle. But then what you want to do here is just like really create a dialogue, not a monologue. Ask them questions, get them engaged. The really, really important one, and one that you'll see on every one of my messaging sheet, is mastering the close, always asking for the referral. And so when you're using compelling language and talking about patients with problems that you have solutions for, it's much easier to ask them who it is that they're engaging with right now that you can help with that problem. So it's a lot easier to ask for the referral, but it's very, very important. That's our key goal here. And then finally, follow up and continuous improvement. So scheduling those follow-ups, nurturing a sequence of follow-ups to maintain the contact that help you build the relationship. All right, so those are some important principles that we're going to now kind of thread throughout this webinar here. So making a difference. All right, so being great isn't enough. Everybody says that they're compassionate caregivers, they're reliable, they're professional. These are expectations as a home care provider. They're not differentiators. So what makes you different? All right, so this is your unique value proposition. It's the reason someone chooses you and not another provider. All right, and this is also the reason that they have a relationship with you. Okay, so your unique value proposition is the clear statement that explains who you help, what specific value you bring, and how you're different from the rest. All right, so so I'm going to give you some examples. All right, so here's what you don't want to do is it's about value, but it's not, you don't want to say we're licensed and bonded. Okay, it's about offer companionship and personal care. It's about solutions. It's not just we customize care plans. These are messages you hear all the time in the industry, but you can't hang your hat on those. These are like cost of entry, right? These are expectations that your referrers have and families have of you. And so that's not really going to necessarily get the phone ringing off the hook. So, so the question is, and my challenge to you is, can you clearly and confidently answer this question? Why should someone refer to you instead of another home care provider? All right, so if you've got the answer to that, over the years, like, let me tell you, I cannot tell you how many presentations I've gone to, networking events or whatever it is, where people have an opportunity to stand up and introduce themselves and tell them a little bit about the organization that they're working for, right? You've all been there. And I hear the marketers for a home care company stand up and say, Debbie Miller and I work with so-and-so home care. We're a non-medical home care company. And that's it. And 32 other people say the same darn thing. All right. I mean, I have heard the good, the bad, and the ugly at these events or presentations or whatever. And the worst one is when a home care provider stands up and says, oh, and by the way, we're looking for caregivers. So if anybody knows people that are looking for work, please send them my direction. So what does that say to your audience? It says you can't staff cases. You haven't got a strong enough caregiver base currently. And I've heard people do this all the time. So you don't want to do that. What you want to do, wherever you're presenting, whether it's one-on-one, at a lunch and learn, at a networking event, whatever, you don't want to stand out by saying we treat your family like our family, or we care deeply about seniors. We've been around a long time. Again, those are just more of those common terminology that we hear in the field. So I want to do a little survey here real quick. And the question is here, you could just answer it right on your screen. Do you, and don't feel bad if you don't, this is just for us to understand, do you have a clearly defined unique value proposition? This is something that only you can say about your home care business that no one else in your community in home care can say. So go ahead and answer that. We got a lot of people left to answer here.
I answered. I put it right there on the screen. I pressed the little A button right there on the screen. By the way, while you're waiting for those to answer, I want to thank Kimberly Jones. We do have someone here who has been here in every one. Kimberly Jones from Auburn, California, Help at Home Senior Care. So Kimberly, thank you for being a loyal listener.
We should get some mugs or something and send it to her. Send it to people that have been with us.
Swag. We need swag for sure.
Marketing moment swag. Maybe Casey can help us with that, or Rachel. All right, looks like all right, so we'll wrap that one up. Oh, here we go.
Yep.
Okay, so no surprise, the majority of folks do not have their unique value proposition. Well, and that's why we're here today, right? So that's good for us. Okay, so let's talk about how you can stand out. You want to communicate and deliver the messages that show value, right? You want to bring value to your calls, to your messaging, whatever it is. So real solutions to real life problems. So what kind of outcomes can you provide? Better health, fewer readmissions, relief to family members? Those are all really important things to be communicating. And you build trust by showing up, okay? Following through and consistently solving problems. You're going to hear me say that a lot. I'm going to be on my soapbox about consistency throughout this presentation. So let's take a look at our audience and what they specifically value, because each one of these targets needs a unique value proposition. Okay, so the three segments that we're going to focus on here are our clients or our seniors. Okay, their families, and then our referrers. Okay, and each referrer is different also. So if you're calling on a case manager, that's going to be different, say, than an executive director at an independent living facility. And so that's important to understand. So here's what they value. Let's look at clients first with the seniors. They value their independence. So how you communicate, how you're supporting their independence is important. That you're compassionate, that you recognize and respect their dignity. And another thing that's not on here is one of the operating motivators that's kind of involved in all their decisions is their need for control. So when you're communicating, you want to always reinforce they're in control. What we're doing is assisting. I always say independence through assistance, but you're the boss. Okay, those kinds of things. From the family perspective, they want peace of mind. They want relief, right? They sometimes are working a job. They've got their own family situation. This is stressful. And they want communication that everything's okay. Those are important. Those are things that they value. Your referrers value somebody that they can trust. When they turn the baton over to you, they know you've got it. That is important. Consistency. There's a lot of turnover in the marketing of home care businesses. And so you consistently show up, you're always solving their problems. You're showing them the outcomes of, what happened when they gave you a referral. Those are things that they're going to value. All right, let me dig a little bit deeper here into the pain points when it comes to our referrers, okay? And again, it's very important to understand their pain points so that you can be resolving them for them. Referrers want partners who, are going to save them time. They're going to prevent readmissions, which is on every healthcare professional's mind right now. Every organization's priority is around reducing readmissions. It might be just getting people out of the hospital, getting them and keeping them out of the hospital. All right, that's really, really key. Keeping the patients and residents at home safely and satisfied. That's important. They don't want calls coming back to them saying, hey, you recommended this person and they haven't showed up for 3 days. They value the families getting help because that's time consuming for them, dealing with families with issues. So when you take care of the families, they're going to appreciate that. One of the big pain points is dealing with the cost of care. It's the number one barrier to people getting the care that they need. So if you can resolve that pain point, you're going to have their attention. And then finally, reducing their workload. Okay, by the way, pain points change over time. There may be some new things that come into play. Like right now, a lot of hospitals are focused on length of stay. All right, they're being pressured by the CEOs to get folks out of the hospital quicker. So yet they can't have them return. So it's a kind of a lose-lose situation. But knowing that's important to them right now at this day and age is, again, understanding their pain points. I'll give you an example. During COVID, there was a whole different set of pain points that our referrers were dealing with, right? Staffing was their major number one issue. So we were able to change our whole proposition and provide staffing for them, right? Every week I would send a report saying, here's who we've got available with their PPE, ready to work. And we were staffing facilities. So as a marketer, what you want to do is be the solution, not another brochure. That's a really important thing, right? I don't want to just be that person with another brochure. Okay, so let's look at the formula. I'm going to make it easy for you. How to create that. Maybe if you could mute the mic, Julio. I'm not sure if that's coming from your laptop or what, but anyway, let's look at this formula. All right, so keeping your segments or your audience in mind when you develop this unique value proposition, here is a step-by-step on how to do it. You want to look at the who, okay, plus what problem you solve, plus why you're the best at it. All right, so let's look at the who. The who who it is you're targeting, who this message is going to be delivered to, the what you problem you solve. Those are the pain points that they're feeling. And then the why you're the best. These are the outcomes that prove what you're saying. Okay, really important. So here's an example of a UVP that you could communicate to a discharge planner. Okay, we help overworked hospital case managers reduce readmissions by delivering consistent hospital home care that actually sticks. So you can see it's kind of a creative way to address many of the pain points that I just reviewed on my last slide. All right, and it's nice and concise, right? So it says to them that, look, I know you're overworked, you don't have time for this. I've got the hospital to home program that you need that's going to keep them at home. So addressing many of those pain points. All right, the power of the elevator pitch. In our last marketing moments, where we looked at the 10 things you need to do to market your business and be successful, one of them was having and nailing down your elevator pitch. So I hope you've been working on this. So I just wanted to remind folks that this is kind of comes into play here. And so this is where you've got 30 seconds where somebody says, hey, what do you do? Boom, here's what I do. I help families sleep at night, knowing mom has professional help, not just for safety, but for emotional support too. And then you would go on to add a few things about, what that looks like. So again, it's just getting folks' attention. What a great way to introduce yourself. Say, I help families sleep at night. Everybody dreads that call, right? That those that are caring for an elderly loved one. And now you've got their attention, and it's not just I'm Debbie from such and such home care, blah, blah, blah. Okay. So let's get back to the UVP here. So I wanted to give you some examples, and you could do screenshots here. Okay. If you wanted to, these are like basic UVPs based on some of the pain points that we talked about, or some of the things that those target audiences value. All right, so let's look at families first. Here's some examples of family-facing UVPs. We help aging parents live safely at home, even when family caregivers can't be there. Or I work with families who want to keep their loved ones at home, but are overwhelmed by daily care needs. We provide flexible care that fits their life, not the other way around. All right, now let's take a look at some ideas on how to speak to your referrers' pain points, okay? And again, there's some good little nuggets in here, so if you want to take a screenshot of this one. And so here are some ones that you may use. Our care team acts as an extension of yours. So this could be if you're working with a rehab discharge team, social workers. We reinforce your care plans, we prevent complications, and keep families informed every step of the way. So remember when I was saying they don't want families on their back, they're going to be on our back. I'm saying that here. We bridge the gap between hospital and home with same-day starts and proactive communication that builds trust and improves outcomes. Your patients deserve a soft landing. We provide personalized one-on-one care that reduces readmissions and supports long-term recovery. So we're covering a lot of things in there. It's delivering a lot of messages that they're going to resonate with them. We help your patients stay safe at home without breaking the bank. Our flexible care plans offer just the right level of support, helping families manage cost while avoiding costly hospital returns. So you see what I'm addressing there, right? Readmissions, cost, families not knowing where to go. Finally, when families are worried about affordability, we offer real solutions, from part-time care that prevents escalation to guidance on long-term care benefits like VA pension, VA community care, etc. We help you discharge with confidence. So that's saying, don't deal with the cost, I'll deal with it. Just pass the baton to me, and I'm going to make sure that we've uncovered every option available to help them deal with the cost barrier. Okay, so lots of good nuggets there. Now, I'm going to share with you some unique differentiators that you can incorporate into your unique value proposition around your offerings, around your services and your offerings. All right, so I'm just going to give you some ideas here because, as I said earlier, a lot of what we all do personal care, we all provide companionship. But if you have something, and Julio was talking about this earlier, where they really help owners with Medicaid, simplifying the whole Medicaid billing process. That is really unique that they have that really differentiates them. So for us in home care, what might some ideas be? I just wanted to get you thinking about this. Here's one. Fast start care within 4 hours. If you could promise and deliver that, I think that is pretty awesome for discharge planners. Readmission risk alerts. This is really important too for, say, if you're working with rehab social workers or the home health teams who are penalized on readmissions. So if your caregivers have some sort of risk alert system in place where they get the call and they have an opportunity to intervene before a hospitalization, you help them with their star ratings and their outcomes that are really important when it comes to Medicare reimbursement. Chronic condition management, if you could package up your services around that, where you have specific strategies for folks that have some of those common chronic conditions like diabetes, CHF, a lot of those issues that cause hospitalizations. 90% of Medicare costs are related to chronic conditions. So again, this is on their mind. If you can speak to some solutions to help them manage that patient population, huge differentiator. You might have a social connection program. You could call it, something cool. Nothing's coming to my mind right now, but around really providing companionship for seniors. So instead of just talking about companionship, we've got a social connection program that gives our caregivers conversation starters that help the caregiver connect and engage the client. So we've got some really unique engagement tools that help combat isolation. Wouldn't that be cool? That would really be a differentiator. You could have hospital to home toolkits where families get a checklist of the recovery essentials to avoid hospitalization. So, keep in mind, hospitals don't have any fancy educational tools and things like that at all. All right. In fact, usually patients get like a bunch of papers and families have to figure out this whole discharge thing. So if you can package things up and make that part of their workflow and ease the pain that the family's feeling, and of course, ultimately what the referrer is feeling as well. Smart tech integration, if you're using technology, that could be a differentiator. Maybe you do a caregiver matching guarantee where you talk about, how some specific ways that you make sure that the caregiver is perfectly aligned to that client's needs. Family education touch points, if you have ways of communicating with the families, keeping them aware of every single thing that's going on in the home, those kinds of things. So I'm just giving you ideas of what you might think about. And, when you're listening to the next networking event, you hear what your competition is saying, if they're saying anything differently. We talked about doing a mystery shop, right? This is one of my favorite things to do to get a better understanding of what your competition is saying when you call in, and that's a great way to know if they're doing any of these things. But definitely you'll be able to think of something that's really different, knowing what they're out there saying. Okay, so just wanted to give you some ideas. All right, so backing it up with outcomes. So anybody can say they offer great care, right? But referrers are, especially nowadays, they're looking for proof. And if we can show real results, you can really shift their thought process from considering you as another agency to a trusted clinical partner in the care continuum. All right. So here are some things that you want to do. Okay. So tracking metrics, tracking the things that matter to them. Okay. Like hospital readmissions, response times, right? Especially for new starts. If you can say, hey, here is our start times. 80% of our clients start within the next day, as an example. So if you're tracking that, that could be a really great message to deliver. Your client retention. All right. If you could show that 80% of the clients that start with you are still with you in 6 months from now, that says a lot to your clients, their families, etc. Caregiver consistency. Look, our referrers know there is a lot of turnover within the caregiver pool. Everybody's, got this fighting for the same caregivers, but if you could show that your caregivers are staying with you, that you get some real stickiness there, that's amazing because your families want consistency. Your referrers want to know the patients are going to be happy. Satisfaction scores, if you use a Home Care Plus or 360, those kinds of things, that's great to share. Put up on your website, send out email blasts, let people know. So if you are tracking readmissions, you could add something like our clients see a 40% fewer readmissions compared to the national average. All right, so that would be great that if you could say that. Share some testimonials and stories, right? So giving them that picture of the patients that you're helping, especially for the ones that they have referred to you. If you could circle back with a report on how they're doing and let them really think about, wow, and give them a snapshot of what life looks like for them now. And they're going to be so happy that they made the right decision in referring to you. And ultimately, you're going to get more referrals. All right. So that's a really nice value that you're bringing. You're giving them an update on how you're doing. All right. So let's take a look. Here is our next survey. And we want to know how many of you are actually tracking outcomes and sharing the data with your referrers. So go ahead and answer the survey now, and we'll get a better understanding of where y'all stand on that. Okay. The answers are coming in. I love this survey technology. You're muted, FYI.
I think this is the first time we used it today, on this new platform.
Oh, yes. Yeah. Yeah, it makes it a little bit easier, doesn't it, on this platform?
Mm-hmm. Here we go. We got lots of answers coming in.
Okay, let's give it a whirl.
All right, look at that.
Interesting. There's big opportunities. I think you'll talk a little bit about that, Julio.
Yes.
At the end there, and how Care Time could help. Wonderful. Well, thank you for answering, y'all. And I'm not surprised. But I think as we move forward in this new realm of measuring outcomes, the more you can supply this kind of information, the more apt these folks will be to partner with you. And that's what we're striving for, is really going for some partners that not just relationships, but partnerships. All right, well, here is the next one. So for those of you who are measuring outcomes, what are you measuring? Let's take a look at what that is. And then again, if you're not, then just click on none of the above. Oh.
These are great questions too, Debbie. I think these are really vital to understanding the impact that you're having on people you're caring for.
Mm-hmm. There's a method to my madness. I'm excited to see what it is here. I bet. Take a guess at what do you think it is, Julio?
That they are tracking or following. I'm going to say client satisfaction and client retention would be my number one.
I was going to say the same thing. All right, let's take a look.
It was close.
Okay, we were right.
That's right.
Yeah, interesting. Very few people are tracking hospitalizations. And that's going to be really important as we move forward in the coming years. Okay. All right, so one of the things that I wanted to comment on was when we think about as education and bringing education to your unique value proposition. Okay. This is something that I have done really successfully. In fact, this is really what the 52-week system is built on. And so why is this so important? People, when you teach instead of sell, people are going to respond to you. Okay. And they're going to see you, the crowd. Okay. When you're bringing education to them, you're positioning yourself as a helpful partner, not just a vendor. So why is this important? 87% of referrers say they value providers who offer helpful resources. Okay, education positions you as an expert, not as a salesperson. And this is really good for folks that are really kind of uncomfortable with the whole salesy thing. This is actually why I'm able to hire, and my model has been to hire social workers as marketers. And they love to teach, but they don't see themselves as salespeople. And so I've created a system that allows them to go in and teach week after week after week, focusing on the pain points and resolving those pain points through our unique value proposition that we're communicating. So when you solve problems, you definitely earn their trust, and education can really help with that. All right, so tools to reinforce your unique value proposition, and particularly around our, this concept of education. So I'm just going to move a couple of things here. So branded educational flyers can be really helpful. We've got personalized follow-up messages that can reinforce that. We've got some examples here too of what I'm ultimately saying is you want to be that go-to resource person for everything related to seniors, okay? Related to families, to care, payer sources, aging successfully, all of those topics, there is so much that we could educate around. And so having this unique value proposition, being that educator, bringing some tools to the table and discussions around patients with problems. And so this is just a really quick glance at some of the tools that we create for the 52-week system. So some of these things that I talk about sound easier said than done, but that's one of the ways that we've really tackled our system, is to create a turnkey, easy way for you to do a lot of the things that I talk about. And one of those is around educational materials. So we have a turnkey system that provides you with a new tool and message for every single week. So when you're calling on your referrers, you have something fresh and you have a business reason to be there, right? And consistency is everything though, right? So it's not about being the loudest. It's about being consistent, showing up often, bringing value every time you call on them. And that makes you easy to remember because you're solving their problems. So let's look at this funnel. I call it the educational funnel, okay? And basically what I'm referring to here is using education as a strategic way to differentiate yourself, okay? So this could be your unique value proposition. And so what's nice about it is you're not just promoting your service, you're solving problems for your target audience, okay? So what's good about that is it elevates you as the expert. So let's take a look at each of these steps. The first one is the top of the funnel, which is awareness and credibility, okay? The goal here is to help people realize that they have a problem, all right? When you call out their problem and they resonate with it, and now you've got the answers, boom, you've got their attention, and you start to build relationship really quickly. So what are some of the things that you can focus on here? Signs of burnout that they could be looking for, checklists when it's time for care, awareness flyers and things like that when it's stroke month and those kinds of things. Let's look at that middle of the funnel, which is education and engagement. Now they're interested. So your job is to equip them and guide them and provide some tools to help them solve those specific problems. So what do I mean here? You might have some printable, downloadable guides, like what to expect in the first 30 days of home care, webinars and workshops for hospital discharge planners that you could be providing, lunch and learns and things like that, where you focus on reducing readmissions through transitional care. Video testimonials, case studies, how respite care helped one family prevent burnout. So lots of things that, you know, you can really make the call so interesting, and it's really going to, again, differentiate you. And then comes the time where they make the referral, right? Where at this point they trust you, and you've become this this true part of their care continuum, part of their workflow, where they're giving, you know, folks your materials and handing them out, and that gets your phone ringing. So I just wanted to share that with you to get you thinking about another way to really bring value to your folks. So I wanted to just share something before we finalize. Seem to be missing one of the slides that I wanted to address, and that is the dreaded list. Does everybody know what I'm talking about? It's the referral list that people say, well, I give a list, and it's their way of not having to be too committed to one person. And there we go. Thank you for that. So here's my challenge. Yes, a lot of folks use the list, but our goal is to get beyond the list. All right. Whether we have our own category on the list or you've created such value, your proposition is so impactful that they don't even give out the list. All right. That's you know, the nirvana place to be, right? But let's talk about, they're not going to budge on the list. Well, create your own category for that list based on some of these specialties, services that I was talking about earlier, like rapid discharge response team. You put that on there under, you know, and you have your own little heading, or hospital home transitional specialist, or fall and prevention, or fall and home safety advocates. All right. So I'm just getting your thought process thinking, depending on what specifically you can package up here. The first thing you have to do, though, is get the list. Find out who has the list and who manages the list, and go and meet with them. All right. Schedule an appointment with the person that owns the list. All right. Then what you'll want to do is present your unique value proposition to them. All right. Show them why you, and validate why you should have your special category on these lists. We have several different providers that have lists, and we have different categories depending on those providers. Okay. So I don't want to give it away, but I'm giving you some ideas on how you might differentiate yourself on that list. But schedule an appointment with them. And what's really cool about this is you get to turn the gatekeeper into a champion. All right. When you share outcomes and you provide the proof and validate why you deserve to have that special category on the list, then what's really cool about that is they typically will, if say it's the director that owns the list, well, now they're going to go and communicate to, say, all the social workers why you have that special category, and they ultimately are advocating for you. All right. So I just want to get you thinking about all of these different things that we all deal with. But when you create that unique value proposition and start threading it into all these different areas, the different people that you call on, what their current workflow is, how you get that thread into their organization is going to be different for each one of them. Okay. So let's go to our, okay. I do have a handout. And that is a little handout that highlights all those key influence centers and what their pain points are. And I did have a slide, I'm not seeing it here, but if you would like that handout that helps you to really understand who your audience is and so on, that would be, you can just let me know here. So go ahead and let me know that you want that. We'll have that sent out to you. And I'm going to go back one. Very good.
participation today. I love how many people are answering questions.
Okay.
Thank you so much for that. It's fantastic.
That's great. So I'm going to wrap it up here, Julio. So to summarize, I always love to end with some action steps for our participants so that you can turn what you've learned into action. And so my first challenge here would be for you to know who your audience is. All right. So figure out who those segments are, what they value, and that's where that handout can really come in handy, what they value, and then create that that unique value proposition that communicates clearly and really helps them resolve those pain points. Okay. Lead with education, not sales. That could be one of your unique value propositions. If you are interested in more information about how 52 Weeks can help you do that, you'll have an opportunity to let us know here in just a minute. Speak directly to their challenges, present solutions to their challenges. All right. So craft your UVP, practice your elevator pitch, educate before you ask for the referral, because you're not just selling home care, you're solving problems, you're relieving burdens, and you're restoring dignity to these seniors. Okay. So that's what we're standing out for. And then ultimately, trust is built when you are solving problems consistently. All right. So would you like to receive, I think we already answered that question, and everybody wants one. Oh boy, Dylan's going to be busy sending that out to folks. So great. We'll definitely get that out to you, and that can really help you with some of your, at least understanding who your targets are and what their pain points are and what the benefits are to home care. Okay, so let's take a look at our next survey question, and then Julio, you'll wrap things up. So are you interested in more information about the 52 Weeks Turnkey Marketing System to help you bring value through educational programs and materials? So let us know if that will be helpful to you, and we will reach out to you and send you a link where we can schedule a meeting to give you some more information. And Dylan is on the call here today. He's actually out of town at a conference, but he is with us, and he will definitely reach out to you and get you some information about our turnkey system that makes a lot of the things that I've been talking about today really, really easy for you. You don't have to reinvent the wheel.
Folks, we have been on this call working with Debbie for over a couple of years now, and I can personally vouch not only for what I've seen in working with her, but people that I've met with her. The program offered by 52 Weeks, it works. It really, really, really does work. So I definitely encourage you to talk to Dylan and Debbie about it for sure.
Yeah, and if you don't have a marketer, we can help you get somebody hired and help you through that whole process. So lots of things that we can do to just come alongside you, especially you folks that don't have any sales and marketing experience. All right, our next one. Go ahead, Julio.
Perfect. So folks, a lot of what Debbie talked about today are things that can be done by yourself and your marketing team and brainstorming among your group. But if you think about it, if your operations aren't efficient, if you don't have your systems in place, locked down, and gather the data you need, if you don't have a solid database to pull the clients and caregivers that you're working with, if you don't have a vendor partner in the software space to make sure that the operations side of your business is running smooth, you won't have time to do all the things you need to do to grow the business organically using the suggestions and the methods that Debbie's talked about. So it's vitally important you're working with a software partner that understands the business and can free you up to get that time you need to really think and strategize how to grow your business. And I would very much like that partner to be Care Time. We have been doing this a very long time. Our value proposition is very simple, right? We help agencies become more efficient and make more money by helping you retain your caregivers, file your claims, get paid faster, and improve your productivity. So if you want to learn more about how we can help you with both your Medicaid billing, your general scheduling, and any other operational challenges you have, I've got a whole staff behind me that has been doing this for years and talked to thousands of agencies a year. They've got great advice if you choose to work with us. So if you'd like to work with us, go ahead and mark yes on the question, and myself or my team will be happy to reach out to you. Thank you so much. We very much appreciate it. All right, Debbie, let's see here. What we have next So obviously we have a next session. We're going for a record on consecutive webinar series. I don't know where we are on the record. Somebody has to call Guinness. But on June 18th, at 12 p.m., we're talking about the power of personal touch, making referrals your superpower. We're going to discover how to establish meaningful relationships with doctors, discharge planners, and case managers to become their go-to recommendation. And then Debbie's going to share her patented tips on networking, maintaining relationships, and ensuring consistent referrals. Folks, this has been Julio Barea with Care Time and Debbie Miller with 52 Weeks Marketing. You can contact us at caretimeus.com. And Mr. Dylan Schwartz is available, Dylan at 52weeksmarketingllc.com. Thank you again. This has been great. I know I say this every time, Debbie, but it's been great. What can I say? It's great every time.
Great to be with you, Julio.
The pleasure was all mine.
Thank you all. Thank you all for being with us, and we look forward to seeing you again next time.
Great. Thank you, Debbie. Good afternoon, folks. Enjoy your day.